This video will discuss the epistemology of health and physical education, as well as the implications for planning and implementing a curriculum within Queensland secondary schools. First, we must discover what epistemology actually means. The word epistemology derives from the Greeks and once translated is the study of knowledge. However, it is often more commonly referred to as the theory of knowledge. Knowledge is seen as justified true belief. For a proposition to be true belief, it needs to be justifiable and fact. Greek philosopher Aristotle once stated that all men by nature desire to know. This desire to know has sent men to the moon and has challenged doctors to find the cure to cancer. Epistemology seeks to discover how we know what we know. So, what does that mean for health and physical education? Well, CARA has developed a curriculum that looks to develop students into healthy, active citizens that can effectively contribute to society. This is evident within the rationale where it states, health and physical education teaches students how to enhance their own and others' health, well-being and physical activity participation in varied and changing contexts. In order to achieve this goal, CARA have divided the curriculum into two interrelated strands. These strands are personal, social, and community health and movement and physical activity. This creates a holistic curriculum that meets CARA's goal and develops students into healthy, active, and informed citizens. To place these strands into a classroom context, CARA has divided each strand into three key ideas that ensures the curriculum meets the desired outcome. Personal, social, and community health looks at developing students to be healthy, safe, and active, communicate and interact for health and well-being, and contribute to healthy and active communities. These key ideas are essential for a growing society as problems such as drug taking, teen suicide, drunk driving, and obesity plague our society. In order for change to occur within health issues, the school community must be unified in regards to policies, curriculum, and the physical environment to promote and encourage healthy lifestyles for students and the wider community. Through this curriculum, students of the future publicly break down the barriers to limit the number of deaths of not only teenagers, but all society. This is a health promotion initiative that develops a sustainable future for the society. Within the second strand, movement and physical activity, CARA has broken down the strand into the areas of moving our body, understanding movement, and learning through movement. There is a lack of physical access to physical activity and is a contributing factor to the growing concern of obesity. Figueroa's framework identifies that students can be affected at 5 different levels. CARA's HB curriculum aims to break down these barriers and involve all students into physical activity, in the hope that all students develop physical activity as a lifelong skill. To understand what knowledge students will develop within movement and physical activity, I will use the example of soccer to explain. Moving our body will develop students' skills of the game as they complete drills, learn the rules of the sport, and enjoy the sport. In order to be successful within the sport, students need to be physically fit, which requires certain training and must be able to meet the demands of the sport. This will develop students' understanding of movement and how it can differ from sport to sport. The final key learning idea is learning through movement, which develops students into leaders and team players through playing the team sports such as soccer. The three key ideas of movement and physical activity will develop students' skills within sport and enable students to love the sport, in the aim of developing students to incorporate sport as a lifelong skill in their lives, and maybe even become professional athletes, such as the one in the video. Successful learning will be ensured as students will acquire, apply, and evaluate each key idea to solidify the learning within the curriculum. Students will acquire the knowledge through research and practical experiences. They will then apply this knowledge to real life experiences to solidify the content. The final learning experience is evaluation and is critical to sum up all learning as it uses the information and skills previously gained in acquiring and applying to make decisions, reach conclusions, solve problems, and justify solutions. This promotes higher order thinking in all students as well as succeeding in achieving the aims of the health and physical education curriculum. Implications for planning and implementing the curriculum. Teachers must ensure the learning experience is authentic, relatable, and engaging. This allows students to enjoy the learning experience and to see the relevance in learning this content as the curriculum applies to the relevance of their lives. The second implication for teachers is to ensure the sequence of learning is sequential and incremental. It is extremely difficult to comprehend new topics if content is all over the place. So by creating the content sequential and incremental, it provides the greatest chance for students to successfully learn what is being taught. The final implication is for teachers to ensure they utilize a textbook which will support the teaching content and will create a holistic learning outcome for all students. To sum up, the epistemology of HPE entails the selection, organization, and sequencing of all the content within the current national curriculum to create a holistic learning outcome for all students.